Practice building is not easy unless you practice in an area where you're the only dermatologist for 100 miles, and then you just open up and you should be busy within the first couple of weeks. But if you practice in an area where there are other dermatologists who are excellent providers, I think it's not easy just to open a practice and have it be busy within a few weeks. So there's certain steps that you have to take in order to build a practice. I think before you start taking those steps, the first thing you have to really think about is what kind of a practice do you want? Do you want a strictly medical practice where you just see medical dermatology? Do you want a strictly cosmetic practice, a mix of something in between, maybe a little Mohs, maybe a little surgical excisions? So you really have to know yourself in order to build the practice that you want. The other thing that I'll say is that it's okay to change your mind while you're in practice. So for example, I was a strictly medical dermatologist when I first started, and now my practice is really medical and cosmetic, because I decided that I was interested in cosmetics really after I started practicing dermatology, and now I sort of changed my practice direction where it's both medical and cosmetic. So it's okay to sort of change while you're practicing already. So how do you attract new patients? Well, I think the most important thing is really through patient referral. So if you're a good doctor, you're good with your patients should be sending you their family members, their friends, etc., etc. Using technology is also very important. So having a good website that has good content, original content, things that really you work on and are your opinions on a blog or on web pages is very important. Social media, things like Facebook, Twitter, LinkedIn, other social media websites would also be important in order to build a practice, because lots of patients really go to the web. Even if they get a referral, they go to the web to sort of vet the person that they're going to go see. They want to see what the practice is like, what is the practice focusing on, what is the doctor all about, what kind of blogs do they have, what is it that they're interested in. I think all of those things are really important to the patients when they come into the office to see you. The other vehicle is through referring doctors. So every patient that walks in my office who's a new patient, I always ask, who is the doctor that sent you to see me? Let's say, well, my family members sent me. Well, did you talk to your physician? Should I send your physician a letter stating that you were here, and these are all the things that we talked about, and these are all the complaints, these are all the things that we've taken care of. So I try to send referring doctors, or maybe patients, doctors who haven't even referred the patient to me, a letter with conclusions of their visits and everything that they've done. If it's a new doctor that you're working with, I think it's also important to pick up the phone every now and again and call and say hello. Say, I saw so-and-so, these are my concerns. Can we work together on this chronic medical illness that they have? Maybe they have psoriasis and the patient hasn't been worked up for cardiovascular disease or for arthritis. You call their primary and say, listen, I diagnosed your patient with psoriasis. You may be aware that there are all these other internal manifestations of the disease, so can we work together in managing this patient? I think that it really creates good relationship between you and the referring doctor. The other thing that's a good idea is maybe throw a few business cards into the envelope with a referring letter, just so that the doctor has your business address and they can hand those cards out to your patients. And I think all of those things are important in building a practice. What I think is the most important thing is really being a good doctor and being really nice to your patients and really going above and beyond to try to help your patients, because if people see that that's what you're all about, you're going to be very busy and you're going to have the practice that you want, and you're going to have a practice full of happy patients, which will make you happy as well. I think online reviews are just a matter of our current environment, and I don't think we're going to be able to escape them. In fact, if anything, patient opinions are going to be more and more important in how we get paid and sort of what kind of practice that you have. So the way that I manage that and the way that I deal with patients, I always ask patients who have had a positive experience that if they get a survey about me through whatever service they may have booked the appointment, like if there's an appointment booking service that they use online, or if there's something that comes directly from the hospital, if they've had a good experience and they have a few extra minutes, just to fill out a survey. And I always encourage them to be honest. And I say, you know, I want your honest opinion because I want to know what we can do to improve the service. Was the wait time too long today? Did you have trouble getting up the elevator in my practice? Was the front staff pleasant? Did they smile when you came in? You know, all of these things are important. How was the cleanliness of the office? These are all the things that I really rely on the patients to tell me about so that we can improve their experience. And I really think if that's how you pose that question to the patient, say, listen, I just want your honest opinion because I want us to get better, I think most people understand that there's a reason for that, and you're not just looking for 5-star reviews, and they're going to give you your honest opinion. I think most people, if they had a positive experience, are going to write about their positive experience. So in conclusion, in order to build a practice, I really think you first have to find out what kind of practice you have, and then utilize all the tools such as the web, referring doctors, but most importantly, your own patients in order to build a practice and have the practice that you want.